Student doctor. Patient with clinical history of progressive shortness of breath over months. Report the chest radiograph first.
This is a frontal chest radiograph of a skeletally mature adult. A bilateral reticulonodular pattern is noted, most marked in the perihilar regions, with relative sparing of the lower lung zones. There are areas of more confluent opacification within the right mid, left upper and left lower lung zones. Both HeLa are prominent. The findings would be most likely due to stage 2 sarcoidosis, although tuberculosis, silicosis and lymphangitis carcinomatosa are in the differential diagnosis.
Student doctor. Can you explain findings on this CT study?
The two lung window images from the CT scan show multiple small paraphyseral, subpleural and parabronchovascular nodules. Areas of beading and irregular thickening can be seen along the bronchovascular bundles. No enlarged lymph nodes are seen on these selected images. The findings are consistent with sarcoidosis. I would want to review the entire CT scan to assess the extent of disease, the presence of lymphadenopathy and the presence of fibrosis. I would like to discuss the case with the clinician, and a referral to a chest physician is required. A search for other foci of disease should be performed. Pulmonary function tests should be performed. The serum angiotensin-converting enzyme should be measured. The combination of the histological finding of non-caseating granuloma and the absence of acid and alcohol-fast bacilli on biopsy samples is the gold standard for the diagnosis of sarcoidosis.
Student doctor. How do you stage sarcoidosis on the chest radiograph?
There are 5 stages. Stage 0, no radiological abnormality. Stage 1, bilateral hilar lymphadenopathy. Stage 2, bilateral hilar lymphadenopathy with parenchymal involvement. Stage 3, parenchymal involvement with no lymphadenopathy. Stage 4, pulmonary fibrosis.
Student doctor. What is the purpose of staging sarcoidosis on the radiograph? Does this staging apply to the CT findings?
It helps predict outcome. Stage 1 disease is associated with 55 to 90% resolution, Stage 2 disease with 40 to 70%, Stage 3 with 10 to 20%, Stage 4 with 0%. The staging does not apply to the CT findings.
Student doctor. How do you make the diagnosis of sarcoidosis?
Diagnosis is clinical and radiological with pathological confirmation of non-caseating granulomas. In many cases, a confident diagnosis can be made with classic imaging and clinical findings without the need for biopsy.